Kenya is bracing for health crisis following the withdrawal of funding from the United States government. HIV and AIDS and tuberculosis patients and even newborn babies are likely to be affected if the government fails to secure funding to combat these diseases. According to Health Cabinet Secretary Dr. Deborah Braza, efforts to map out the affected areas has already begun, with a move likely to affect finance and human resources within state agencies which have been benefiting from the aid. Kevin Mutai tells us more from Mombasa.
Trump ametangaza ya kwamba atatoa Amerika kutoka kwa WHO.
The pronouncement by US President Donald Trump via an executive order to temporarily freeze the supply of life-saving medical products has sent shockwaves in the global health sector. Kenya is among the countries that will be affected by this directive, denying the country the vital drugs to contain diseases such as HIV and AIDS, tuberculosis, malaria, and even medical supplies for newborn babies.
America ndio imekuwa kusaidia sana kwa hiyo Global Fund, na tunatarajia ya kwamba hawatatoka na wataendelea kusaidia. Iwapo watatoka, kama nchi lazima tukuwe na mbinu zetu za vile tutajimudu.
Kenya has been benefiting from approximately 25 billion shillings channeled from the President's emergency plan for AIDS relief and anti-HIV program of the US government. According to the 2023 National Endemic Disease Control Council report, an estimated 1.4 million people in Kenya were living with HIV, out of which 71,433 of those affected being the children. Additionally, 16,752 new HIV infections were also recorded during the same year in the country, with Kenya ranked 7th with a high number of AIDS-related deaths in 2023.
As the Ministry of Health, I have tasked the various state departments, the various programs and directors that have been involved or that will be affected by this, so that we can be able to map out and look at the impact in matters finances, in matters human resource.
Interruptions in these treatments might have far-reaching implications, such as the risk of HIV transmissions or even death from other diseases under the Global Health Program. Ms. Barasa says the matter will be forwarded to the cabinet in order to seek immediate interventions.
We kindly request that you give us some time before concretizing this, and we'll be able to share with the rest of the country.
Also affected is the USAID, an organization that has been Kenya's partner in suppressing the deadly diseases in the country. Kevin Mutai, NTV in Mombasa.